everybody. Welcome to the Minnesota Stroke Program monthly webinar series. This month, we're talking about stroke, public awareness, and community education. If you cannot hear me, please type into the chat, or if you want me to speak up a little louder, just type it into the chat and we will adjust. So my name is Claire Fleming. I'm the evaluation specialist for the Minnesota Stroke Program. I also coordinate our public awareness activities. You usually hear my voice behind the scenes running the WebEx, but today I get to be your speaker and presenter. So I'm excited to talk to you about stroke public awareness today. You can see a picture of me there on the right. That's me with Sven, one of our EMS simulation mannequins. So today we're going to talk about stroke public awareness. We're going to talk about the resources and activities we have going on around public awareness at MDH. And then I'm also going to pass it over to a group of Regents who's going to talk about a project they did on stroke education in the Hmong community. And then at the end, we'll have some time for questions, discussion, and sharing. So if you do have a question, please chime in on the chat. If you go look on the left-hand side, there's a little chat icon on the right-hand side. Just hit chat and then select everyone in the drop-down. Type your question and hit send. You can't hit return to send your question. And then we will respond to you on the chat. At the end of the webinar, we will have time for questions, and at that time you can unmute your line to ask us a question. To do that, you just hit *6 on your phone. Until then, we've got everybody muted as they come in, just so that it's easier to pay attention to the webinar. Our stroke public awareness campaign at MDH is called Every Second Counts. You might have seen it before. Hopefully you've seen it before on our badge tags, on our public awareness toolkit, on our website, or maybe you've even seen it on a billboard. It also appears on some pre-hospital materials as well. We kind of like to think about it as our awareness brand, if you will. Our goal at MDH for stroke public awareness is to focus on simple and recognizable and consistent messaging around stroke signs and symptoms. And we hope that we're making this messaging available for hospitals or even for EMS or public health or other organizations around the state that are doing this type of work. So we hope that by building greater awareness around stroke, we can help people recognize the signs and symptoms of stroke, and that they'll be able to recognize those more quickly and call 911 quickly at first recognition. And we hope that this will lead to shorter last known well times, an increased number of candidates for intervention like alteplase or endovascular treatment, and ultimately a decrease in stroke mortality and disability. We've also decided to change our messaging from fast to be fast. And we decided to do this because it's more inclusive of other stroke symptoms like balance loss and eyesight changes. In addition, the addition of these symptoms are more inclusive of those posterior strokes. A study from 2017 found that 14% of ischemic strokes were not identified by using FAST alone. That might have been caught using BFAST. So some important things to note here as we talk about our switch from FAST to BFAST, that there have not been a great deal of studies on this, especially on the public awareness impact of FAST versus BFAST. So we won't be able to point you toward any great peer-reviewed cross-blind studies about the effectiveness or the impact of this in the public awareness realm, but we do think that it's going to be more inclusive and we noticed that there are a lot of facilities around the country that are switching to BFAST. We also want to note that this does not mean that BFAST is a requirement for your hospital or for your organization. It just means that we are going to use BFAST. And we just wanted to make that really clear, that it's simply the messaging that we are choosing to go with. So moving forward, we're going to update our stroke communications toolkits and our graphic images to include the BFAST messaging. We have a website. We have an Every Second Counts website on our website, on our stroke page at MDH. And on this website, we really like to highlight the importance and value of a strong public awareness around stroke. The website says, this stroke system works best when people know the signs and symptoms of stroke and can act quickly to get that person care. Calling 911 can save a life. Stroke care starts in the ambulance, and emergency medical services is an important part of the acute stroke ready team. So on the website, you'll find some of that important messaging, and then you'll also find our stroke communications toolkit and the order form for those graphic images, and I'll explain what that is right now. The stroke communications toolkit is for hospitals, but it's also for EMS or public health or other organizations that are doing stroke awareness. And what it does is provide a variety of different stroke public awareness activities that you might want to do, and give you step-by-step instructions on how to get started on those different activities. The activities include a survivor story, a press release, billboards, bus shelters, social media, and print materials like posters and infographics. And these steps include how to get started, possible locations you could do these activities, what audience you might want to target, what things to consider while you're doing this activity, and it provides a calendar that helps you map out your activities throughout the year so you can really form a campaign or a work plan for all of your stroke awareness activities. And it's important to note that all of the activities provided, the stroke toolkit is free, and most of the activities, we created a graphic image that corresponds with that activity that you can also download for free. So the billboard has a billboard graphic that goes with it that you can download and use if you wanted to put up the billboard. All of these graphic images are available with and without the MDH logo, just in case co-branding is difficult for you. And there's a space to put your hospital or facility logo or web page. To download these, go onto our website, and the first thing you do is download the Stroke Communications Toolkit, and then you would go onto our Every Second Counts Stroke Awareness Order Form, which you can find on the website, and that's how you would request those graphic images. So here is a peek at what the images look like. There's an infographic, newspaper ad, social media graphic, billboard, poster, and bus ad. You'll notice that each image has a place for your organization's logo or website, and each image has two versions, one with and one without the MDH logo. And we wanted to make this really easy, so you could just take this, download it, put your logo on it if you wanted to, and start your awareness campaign. We also provided in the toolkit some ideas for social media posts for Stroke Month. So we provided some Facebook posts, some starters to get you started, and some Twitter starters. These all are Minnesota specific, and you can feel free to take these, use them verbatim, or edit them to be specific to your organization or facility, and post all over social media. We're encouraging people to go ahead and use these for Stroke Month, and you can add the hashtag Stroke Month to be included in all of the other messaging going on during that time. It's one of the easiest and least costly activities that you can do, and they're really accessible right in that toolkit if you want to download it. I also wanted to highlight just a couple of examples of people who have used the toolkit or images. Riverwood Healthcare Center in Aitkin County used our billboard design for their billboard off of 169. You can see they co-branded with us in the right-hand corner, throwing their logo on there as well. I also wanted to highlight the pilot project we're doing with the White Earth Nation in Northwest Minnesota. I think they're on the call today, so hi guys if you're on the call. They're doing some really stellar work around stroke public awareness, including taking our images and editing them to be more culturally appropriate and meaningful. So you can see the image on the right. They added their tribal logo in the middle of the circle, and they changed the colors so that it's more significant for their community. I love the addition of their logo. They're also doing several stroke awareness activities in their community, including putting up posters around the community, some stroke-specific community events, newspaper articles, social media posts for International Stroke Day and Stroke Month, and TV or radio PSAs around their tribal health facility buildings. And they're also doing some stroke awareness curriculum in schools. We got this stroke awareness curriculum from Mount Carmel Hospital in Ohio. And what it does is a 1-hour block of curriculum for school-age kids like 3rd grade to 5th grade. And it's all about recognizing the signs and symptoms of stroke and calling 911. So they use BFAST, and for each letter of BFAST, the students do a different interactive activity, such as trying to say phrases with marshmallows in their mouth for slurred speech, or attempting to button a shirt with a glove on. And so each letter has a different activity. And it's a really fun way to teach kids about stroke awareness, and it also includes a pre and a post test, and then a second post test a month or even a week later just to test the kids' retention of the information. This is also available. If you're interested in this, please let me know. Included in the Stroke Communications Toolkit are some ideas on how to evaluate your public awareness activities. So these are available on there as well, just some measures to get you started, but feel free to reach out to me as well to kind of talk through what you're doing and brainstorm ideas on how you might evaluate how it went and if it had any impact. Finally, I just really want to put out a call for all of you to reach out to me and let me know what you're doing, what kind of stroke public awareness activities you're doing, and if you're using the toolkit. It's so helpful to hear from people that are using the toolkit because it lets us know which activities are helpful, which are harder to do, which seem like the most effective, and which maybe aren't super appropriate for your type of facility. This helps us create an even better toolkit in the future, and hearing from people that it's valuable will help give us momentum, and it'll help demonstrate the value of this type of activity so we can provide even more types of these activities in the future. So if you have used the toolkit, if you have suggestions on how to improve the toolkit or images, or if you want to talk about the barriers you have to doing public awareness activities, please reach out to me, shoot me an email, give me a call, let me know how that is going. So with that, I think I'm going to pass it off to our presenters for the day. They are presenting from Regents Hospital, and I'm going to let them introduce themselves and take it from here.
Hi, everyone. This is Carol Draghi-Miller from Regents Hospital. I'm the Stroke Program Coordinator.
I'm Dr. Hussein. I'm the Medical Director of Regents Hospital Comprehensive Stroke Center.
And I'm Paco Xiong, and I work in the Community Relations Department of Health Partners, which Regents Hospitals is a part of.
So we are going to talk to you today about our efforts engaging with the Hmong community, and particularly the cross-cultural adaptation of the American Heart Association education material into Hmong. And the story started a few years ago with a question posed to us by someone in a meeting if we know of any differences between stroke in the Hmong community versus the general population, and we did not know. So we ended up doing a retrospective analysis of our own data using the clan name, which is also used as the last name. There are 18 Hmong clans, and using the clan name or the last name, we were able to identify the Hmong population, and we compared the stroke patients of Hmong community with the rest, and we found important differences. There's a lot more hemorrhage in the Hmong community compared to the general population, and there is also much younger age when they suffered their first stroke, about 10 years younger. The patients with ischemic stroke had higher prevalence of intracranial atherosclerosis and small vessel disease. Vascular risk factors such as hypertension and diabetes and hyperlipidemia were worse controlled before the stroke compared to the majority of the patients. So on average, the A1C for diabetics was something like 11 or something like that, and LDL was in the 130s, 140s. We also found important differences in healthcare utilization. So Hmong patients were less likely to come with an ambulance. They were also less likely to go to rehab, despite having similar neurologic deficits at the end of the hospital stay. So with this information, we wanted to engage with the Hmong community, and we had an initiative at Regents Hospital for that, and we did several things in trying to reach out to the Hmong community. We went to a middle school, Hope Academy in St. Paul, and we partnered with a science teacher, and we had a unit on stroke, kind of similar to what we just heard. We used FAST to educate the middle school kids about stroke symptoms and what to do when a stroke happens. And part of the work at the middle school was for the kids to create some art projects that are focused on the FAST message, and we gave we selected 3 winners, and we gave them rewards for their artistic achievement. We gave extra credit for those who can include English and Hmong languages in their design, in their posters. We also engaged with the families of those kids, and we had kind of stroke awareness night at the school, and we went to the Hmong village, and we had a similar activity. We had 4 stations, one for blood pressure and risk factors, and what to do with EMS and 911, and something about diet, the kind of thing. We found also we did a stroke survey, health literacy survey focused on stroke, asking what does the word stroke means, what is the name of the disease that causes weakness of one side of the body, and because we kind of felt that there is some language gap between us. And we found very interesting findings. First, at the school, something like 1/3 of the kids did not know their own home address or their phone number. So if you call 911 and you want to report something, some emergency, you have to have the address. You have to know the address. So when we did this stroke survey, we found that there isn't a word equivalent to stroke in Hmong, and they would use a description, something like half the body is dead or something like that. And there was also a gap in knowledge about stroke symptoms and what to do when there is a stroke. So there was a clear need for more engagement with the community, and that's why we did these educational events. Another thing we did, which is the focus of this talk, is the translation project, which actually translation is not a very accurate word, because we didn't translate word for word the AHA education material to Hmong. It was more cross-cultural adaptation. So we changed even the pictures and the wording so that it's more relatable and more understandable to the Hmong community. And I'm going to pass it on here to Carol and Paku to discuss more details of how we were able to accomplish the translation project.
So the first thing that we did, knowing that we wanted to do some translation and knowing that there was going to be costs associated with that, is there is an internal foundation option at Regents Hospital. The employees contribute to a fund that then, with a team of folks, make decisions about how they are going to distribute those funds toward projects that come forward. And we were a lucky recipient after applying for grant funding for our translation project near the end of, actually spring of 2018. And the first thing we did was, with the intention of translating the American Heart Association, American Stroke Association one-page summary documents that we were currently handing out or distributing to our stroke patients within the hospital, we wanted to translate those in Hmong. We partnered with an individual from the Patient Education Department of the American Heart Association and entered into a contractual agreement to together work on translating those documents. And we determined that we were going to do 8 of those documents. And the goal was, as Dr. Hussein mentioned, we wanted them to be simple messages with appropriate images, relatable to the user. So Paku's going to go. Or do you want me to go this time? Okay. So this slide depicts on the left, you can see one of the 8 American Heart Association Let's Talk About Stroke documents that we elected to translate. The left is the image as it currently stood when we began our project and the content that was part of it. And then on the right is the final product after months of working together to create a more culturally sensitive document. We re-photographed and elected to change some of the wording within the document together as a team. Want me to go? No?
And with this translation, I think when a lot of people, they look at translation, they say, okay, this is the English document, and we're just going to get it over to a translation agency and have it translated. But one step that we took was we reviewed the English version and made sure that the English version was culturally relevant to the Hmong community. So as you can see in the highlighted area, we also added that unique information that compared to whites, stroke among members of the Hmong community tends to happen at a younger age and is more often associated with poorly controlled risk factors such as blood pressure, diabetes, or cholesterol. So in the actual English ones, you didn't have that, but to make this culturally, to target the Hmong communities, we added that in. In addition, we viewed this as not just education piece for the Hmong community, but also for the providers also. So we kept the English words such as like risk factors in English, and then we also provided the translation in Hmong, so that when those words are recognized, both parties knew what they meant. So Carol put together this really fun slide of the volunteers and people who were a part of this translation project. So my background is in community, and so I felt that it was really important for us to build community and build trust within the community. I didn't want to just say, here's Regents Hospital, we need you, and this is what we need you to do, but really to build that trust that Regents Hospital Stroke Center is here to help and support you, and also providing the health education about stroke, but also supporting local talent too. So, we knew that we wanted photos that were representative of the Hmong community here in Minnesota and, all over the world. So we partnered with Hmong Elder Daycare Center, which is the main photo in the center there. Those were volunteers who wanted to be a part of this project. And then we also hired a local photographer so that we can support our local talents here in Minnesota. And so these are some photos that we shot at the Elder Daycare Center in spring. I think we had to rearrange a few times because of the snow and the weather, but the groups were really excited to be a part of this and to know that their work, their contributions would make some kind of impact. So for this particular slide, we did really tedious line by line, making sure that the English part and the Hmong part would make sense. So we reviewed it with, as for cultural understanding. So we had like bi-weekly meetings just to review each document to make sure that the translations made sense. So with a translation agency, it's really great, but it's really valuable to have a cultural consultant because they would be able to provide that cultural background of, yes, the translation agency did this, but, we're interpreting it in this way, and it would make sense to change it up a little bit. So we did take some suggestions from the translation agency, but we also worked closely with our Regents Hospital's interpreters and Hmong nurses and myself to really make sure that the Hmong translations would make sense. Because if Carol were to review this, she wouldn't know if the Hmong translations made any sense. And then we kept some of the animated photos in the translation. So we also recreated the fast images using, again, volunteers from the Hmong community. And so we were really grateful that these two particular volunteers were able to really show the visual of face, arms, the slurred speech, and the time in dialing 911. So, and then these next few slides, they just showed what we did, to make the photos culturally relevant and relatable. And so these are some of the fun lifestyle changes photos that we took, to show exercising in a group, rather than using the stock photos of community members that were not relatable. And in this particular document, we showed about stroke and rehab. And the great thing was that the area where there was a red circle there, the volunteer was actually wearing sandals, and so we went in to Photoshop, and we Photoshopped a closed-toe shoe. So it was really great, and this really showed how rehab would look like for a community member who may not be familiar with rehab.
Just to let you know, sorry, we're at 12:30 right now. So if anybody needs to jump off, I just want to say that we will have this webinar recording available for you to listen to, and then we'll also be sending up a follow-up email with the slides and with an evaluation survey. So I didn't mean to interrupt, but keep going. I just wanted to let people know that if they have to jump off right now.
So I do apologize, but this final step is really important, is that we went back to the community and the volunteers and we shared the final product. I think a lot of times institutions, we forget to go back to the communities where we have gained their support and their trust, and we forget to go back to share the final product. And so this is a really important step in sharing the final product with the Hmong Elder Care Centers to continue to learn from them, to continue to build the trust, and to also share that their contribution is valuable and that we will be able, that they've made an impact in supporting this work, and that we'll be distributing it to the communities nationwide. And so Kara will.
So we have these documents, these English and Hmong versions of the American Heart Association, American Stroke Association documents in our internal systems that we can access easily for printing and handing to Hmong patients. But outside Health Partners, we don't have a vehicle for that or an access or a link or anything for you. So all the listeners on the phone, we will arrange with Claire and coordinate so that you can have access to the English and Hmong versions of these for your communities. Were you to be interested, we'll send those out afterwards. And next steps for us, we're going back to the Hmong Healthcare Professionals Coalition. The HHCPC is a local group of Hmong healthcare professionals that volunteer their time to be aware of and in on health-related concerns for their community. And we're going back to them to share the product and the outcome of the way they supported us through the project. And then the ideas, we're just brainstorming about ways to communicate the final product with the rest of the state, the country, the world that might use Hmong translated documents. And so we're going to maybe target geographies, look at other stroke coordinator groups, conferences, publications, that sort of thing. We learned with the discussions with our Hmong healthcare professional colleagues that YouTube video and billboards are two easy, nice ways that are effective in the Hmong community, and so we're looking to maybe perhaps request funds to be able to do something like that. And these are the persons that helped us, all the persons along the way to make this work. And I'm sorry that we went a couple minutes over, but if anyone has any questions, I'm here to answer.
Just push *6 on your phone to unmute your line. No questions?
Well, this is Angie from the university. I just want to say, wow, this is fantastic. And like you said, next to the world. So thank you for sharing this and doing this work. This is fantastic.
Thank you, Angie.
Thank you.
Would you mind going back to that previous slide? I was just interested in what service you use to do the translations. Is that listed here?
No, we didn't.
No, it was called TransPerfect.
TRANS Perfect?
Yes.
Okay.
And
great.
Just as an aside, we were guesstimating the amount of dollars that we were going to need to be able to do these documents. And I didn't include that, but I was pleasantly surprised at the cost that came through, even after paying for the contractual agreements and the photographer and the various things. This project came under budget.
Wow.
Great.
So
thank you.
It was a pleasant outcome in the end.
A good cost to benefit ratio, I'm sure.
Yes.
Yeah. Any other questions?
Hi, my name is Fred Andrews, and I have our facilities Education Coordinator John Moe with us on this. And we were wondering, in our geographic area, which is up in Grand Marais, this looks very interesting, and we were wondering if there was any move towards Native American languages, Athabascan, and things like that, to do the same thing.
There is interest in our next targeted group was here at Regions. We were thinking about Somali and how we could create more culturally sensitive material for the Somali group. But you've raised another good group to put in the line. I think that would all be valuable. And hopefully with the presentation today, you can always reach out to us where our information is at the back of the slide deck, but we'll help you coordinate those efforts if those are something that you want to do from your end.
I think that's something we're also interested in at the health department as well. So feel free to loop us in on that too.
Yeah, thank you, Claire.
I also pulled up the slide with our website again, if you want it, and I'm going to include it in our follow-up email as well. If there's no other questions, you can also send a question to, I'm sure, Carol Hytham or Paku, but feel free to reach out to me as well. This is my email, and we're really grateful that you joined us today for this webinar. We have an evaluation survey that we'll be sending out with the follow-up email along with slides and a link to the recording of the webinar. And after you complete the evaluation survey, you get a half an hour of contact hours. So that's exciting as well. Another incentive to fill out the survey. So with that, I'll say thank you so much for joining us. If you have any questions, reach out. Otherwise, we will see you next webinar on the 26th of April, and the topic of that will be the Minnesota Stroke Registry. Oh, it's the 25th of April. My apologies. So we will see you on the 25th. Thank you, everybody.
Thank you.